Anthony was 68, a retired engineer. For 4 years, he had taken magnesium glycinate every single night before bed. The same bottle, the same dose, the same routine. He had read every article. He had checked every label. He believed, the way many seniors believe, that he was doing the right thing for his sleep, for his blood pressure, for the cramps in his calves that woke him at 3 in the morning. Anthony's sleep was still terrible. His blood pressure had crept up to 145/90. The cramps still woke him 3 nights a week. And the supplement, at almost $30 a bottle, was costing him close to $350 a year. His wife Beverly handed him a small glass jar one afternoon. She told him she had read something she wanted him to try. Inside the jar were pumpkin seeds. Just pumpkin seeds. Unsalted. Raw. She told him to eat 1 small handful a day with his dinner. Anthony was skeptical. He kept taking his supplement, just in case. 3 weeks later, he started noticing the cramps were gone. 6 weeks in, his sleep had quietly deepened. 8 weeks in, at his next checkup, his blood pressure was down to 128/78. He stopped buying the supplement. He has not gone back. Today, I'm going to walk you through one of the most important conversations in senior nutrition that almost no doctor has time to have. The conversation about why the magnesium supplement that millions of seniors take every single night is, for many of them, dramatically less effective than a single, inexpensive food they have probably never put on their plate. The food Anthony's wife gave him. The food I will tell you exactly how to use, how much to eat, when to eat it, and who absolutely should not. I want to be very clear at the start. I am not telling you to throw away your supplement without talking to your doctor. I am not anti-supplement. There are seniors who genuinely need supplementation, and for them, magnesium glycinate is a reasonable choice. What I am telling you is that the medical literature on whole food magnesium sources, and on this food in particular, deserves a place in every senior's kitchen, and almost nobody is being told why. Stay with me through reason number 3, because that is the one men over 60 in particular should not miss. And the protocol I share at the end is one I have read about in clinical studies for years and almost never heard mentioned in a regular primary care appointment. My name is Dr. Goodman. On this channel, I dig through the medical literature on senior health and translate what the evidence actually shows into plain language you can use. If you haven't subscribed yet, I would genuinely appreciate it. Now, before I name the food, you need one concept. The human body did not evolve to absorb isolated minerals from a capsule. It evolved over hundreds of thousands of years to absorb minerals from food in the company of other nutrients that work with them. Magnesium in nature does not arrive alone. It arrives with potassium, with calcium, with zinc, with manganese, with healthy fats that improve its absorption, with small amounts of B vitamins, with tryptophan, with fiber, with antioxidants. The body has spent its evolutionary history learning to extract magnesium efficiently from this combination. When you take a magnesium glycinate capsule, you are receiving the mineral in isolation. The capsule does deliver magnesium, but it does not deliver the food matrix that the body knows how to work with. And after the age of 60, when stomach acid production drops, when absorption slows, when the gut microbiome shifts, the difference between isolated and matrix-bound minerals becomes significant. This is the reason millions of seniors faithfully take magnesium glycinate every night and still have leg cramps, still have poor sleep, still have rising blood pressure, still have constipation, and still feel that the supplement is not really doing anything. Because for many of them, it is not doing very much. The food I am about to name solves this problem at the level of biology. It is one of the densest natural sources of magnesium on the planet. It arrives with every cofactor your body needs to absorb and use that magnesium. And it has been studied for decades, with documented benefits across 5 specific areas of senior health. Before I name it, drop a comment below telling me how long you have been taking a magnesium supplement and which form. glycinate, citrate, oxide, or any other. I read every comment, and the patterns you share help me understand what this community is navigating. The food is the humble pumpkin seed. I know, that cannot be it. It sounds too simple. It sounds too small. It sounds like the kind of advice your grandmother would have given you. And in some ways, that is exactly why it works. That is significantly more bioavailable magnesium than the standard dose of most magnesium glycinate capsules. And it arrives accompanied by every nutrient cofactor I just described. Let me walk you through the 5 specific benefits the medical literature has documented for pumpkin seeds in adults over 60. We are counting them out in order of how strong the evidence is. Benefit number 1. Sleep that finally feels deep. The single most common reason seniors take magnesium glycinate is sleep. Pumpkin seeds deliver this through 2 mechanisms at once. The first is the magnesium itself, which activates the parasympathetic nervous system, the part of your body that tells the heart rate to slow and the muscles to relax. The second is tryptophan, the amino acid that is the direct biochemical precursor to serotonin and then melatonin, the hormones that govern sleep architecture. Pumpkin seeds are one of the densest plant sources of tryptophan on Earth, roughly half a gram per ounce. A clinical study published in the journal Nutritional Neuroscience found that a small evening serving of pumpkin seeds, combined with a source of carbohydrate, produced a measurable improvement in objective sleep quality scores in older adults. The tryptophan was the active component. The magnesium amplified the effect. This is the reason Anthony's sleep began to deepen at 6 weeks. He was getting both at the same time, from food, in the form his body had evolved to absorb. Doris was 70, had been a chronic poor sleeper for years, had tried melatonin, magnesium glycinate, valerian, and an OTC sleep aid she was supposed to have stopped 2 years ago. Her geriatrician suggested replacing the supplements with a small serving of pumpkin seeds and a small piece of fruit 2 hours before bed. Within 3 weeks, she was sleeping 6.5 hours uninterrupted for the first time in a decade. She has not taken the OTC sleep aid since. Benefit number 2. Blood pressure that quietly falls into the normal range. Magnesium is a powerful natural blood pressure regulator. It helps the smooth muscle of the blood vessels relax. It supports proper potassium balance. It modulates the activity of the parts of the nervous system that drive vascular tone. Multiple meta-analyses, including one published in the journal Hypertension, have shown that magnesium supplementation in adults with elevated blood pressure produces a modest but clinically meaningful reduction in both systolic and diastolic numbers. The effect is real. It is not enormous, but it is consistent. What is less discussed in those analyses is that the magnesium delivered through a food matrix appears to produce a slightly more reliable response, because the pumpkin seed delivers magnesium with potassium, with zinc, with healthy fats, and with arginine, an amino acid the body uses to produce nitric oxide, the master regulator of blood vessel relaxation. The combination is more effective than any of its parts alone. This is the reason Anthony's blood pressure dropped 17 points over 8 weeks. It was not the magnesium alone. It was the magnesium plus everything else the seed delivered, in the form his body had spent his whole life expecting. Benefit number 3. The one men over 60 should not skip. Prostate health. This is the benefit that almost no senior knows about, and the one with some of the strongest historical evidence behind it. For more than 4 decades, pumpkin seeds and pumpkin seed oil have been studied in Europe as a natural support for men with benign prostatic hyperplasia, the non-cancerous enlargement of the prostate that affects more than half of men over 60. The German Commission E, which is the European equivalent of the FDA for herbal medicine, has approved pumpkin seed as a supportive treatment for the lower urinary symptoms of BPH for over 30 years. A clinical study published in the journal Urologia Internationalis followed men with documented BPH symptoms over 12 months. One group received standard care. One group received a daily serving of pumpkin seed oil, or whole seeds. The pumpkin seed group showed statistically significant improvement in nighttime urination frequency, urinary urgency, and quality of life scores. The mechanism is believed to involve a combination of zinc content, phytosterols that modulate prostate inflammation, and the way fatty acids in the seed influence the conversion of testosterone to dihydrotestosterone. Roy was 71, was waking up 4 to 5 times a night to urinate, had been on a prescription prostate medication that gave him dizziness when he stood up. His urologist suggested he add daily pumpkin seeds to his routine and reevaluate in 3 months. He went from 4 to 5 wakes a night to 1 or 2. His urologist agreed to taper his prescription medication over the following 6 months. Men over 60, you in particular should hear this. The seed is not a replacement for medical care of the prostate, and prostate symptoms always need a urology evaluation to rule out cancer. But as part of a complete care plan, the evidence for pumpkin seeds is some of the most robust in nutritional medicine, and most men have never been told. If you are still with me and finding this useful, type the word YES in the comments below. It signals YouTube to put this video in front of one more senior who quietly needs to hear this. Benefit number 4, leg and calf cramps that finally stop waking you up at night. Nighttime calf cramps in seniors are one of the most common reasons magnesium supplementation gets recommended in the first place. The mechanism is straightforward. Magnesium is essential for muscle relaxation. Calcium drives muscle contraction. Magnesium tells the muscle to release. When magnesium runs low, the release fails. The muscle locks. Pumpkin seeds deliver the magnesium that ends this pattern in a form the body can use, and they do it without the gastrointestinal side effects that some seniors get from magnesium oxide or magnesium citrate supplementation. A daily serving of pumpkin seeds in the evening, paired with adequate hydration during the day, has been documented in clinical case series as effective for resolving chronic nocturnal leg cramps in many older adults. The cramps reduce within weeks. For some seniors, they disappear entirely. Anthony's cramps were the first thing to resolve. 3 weeks, from 3 nights a week to 0. He told his cardiologist about it. His cardiologist had not heard the connection and asked him to write it down. Benefit number 5, a quieter blood sugar response after meals. This is the benefit nobody is talking about, and it may be one of the most important for seniors who have prediabetes or who are trying to keep prediabetes from progressing. A serving of pumpkin seeds delivers approximately 7 grams of protein, 5 grams of fiber, and a strong dose of magnesium, all of which contribute to a slower release of glucose into the bloodstream after a meal. The magnesium itself plays a direct role in insulin sensitivity. Multiple studies, including a meta-analysis in the journal Diabetes Care, have linked higher dietary magnesium intake to lower risk of type 2 diabetes and to improved insulin function. For seniors with prediabetes or with diabetes that is moderately well controlled, the addition of a daily serving of pumpkin seeds paired with a meal has been associated with modest improvements in fasting glucose and HbA1c over months of consistent use. It is not a substitute for any prescribed medication. It is one more meaningful piece of the dietary puzzle. Now, the protocol. How to actually use pumpkin seeds the right way. Step 1. Choose raw or lightly dry roasted, unsalted, whole pumpkin seeds. Not the bright green Mexican pepitas only, although those are fine. The grayish tan whole seed with the white outer shell is also fine if you find it. Avoid heavily salted versions because the sodium load works against the blood pressure benefit. Avoid sugar-coated versions entirely. Step 2. The dose. 1 ounce, which is approximately a small handful or about a quarter cup per day. Some seniors do well at half this amount and build up over a week or 2 if they have a sensitive digestive system. Begin small. Settle into the dose that works for you. Step 3. The timing. For sleep and leg cramp benefits, eat your portion with dinner or as a small evening snack roughly 2 hours before bed, paired with a small piece of fruit. The carbohydrate from the fruit helps the tryptophan cross into the brain more effectively. For prostate and metabolic benefits, the timing matters less, although consistency matters a lot. Step 4. Storage. Pumpkin seeds contain healthy fats that can go rancid. Keep them in an airtight container in the refrigerator or a cool, dark cupboard. Buy them in smaller quantities. Smell them before each serving. If they smell stale or off, throw them out. Step 5. The 4-week test. Give the seeds a full month before you assess whether they are helping you. Sleep, cramps, and prostate symptoms tend to respond first. Blood pressure changes are usually visible at 6 to 12 weeks. Set a calendar reminder. Take a baseline note now of your sleep, your cramps, your nighttime bathroom trips, and if you check it at home, your blood pressure. Recheck those notes in 4 weeks and again at 12 weeks. Now, the important warnings. Who should not jump into this protocol without talking to their doctor first? If you have chronic kidney disease at any stage, the increased magnesium and potassium load from regular pumpkin seed consumption can be a problem. Speak with your nephrologist before adding them. If you are on blood thinners, particularly warfarin, the high vitamin K content of some seed varieties can interfere with anticoagulation. Discuss with your physician. If you are on diuretics or blood pressure medications that already lower potassium or alter electrolytes, your dose may need adjustment. This is a conversation with your prescriber, not a unilateral decision. If you have a known seed allergy, do not eat seeds. This should be obvious. It is also occasionally overlooked. If you have severe gastrointestinal disorders, including active diverticulitis, the fiber and the small, hard seed coats can be irritating during a flare. Talk to your gastroenterologist about timing. And finally, if you are currently scheduled for surgery in the next 2 weeks, pause the protocol and tell your surgeon what you have been eating. I want to leave you with this. There is nothing wrong with magnesium glycinate as a supplement. For some seniors, particularly those with documented severe deficiency, with malabsorption conditions, or those who simply cannot or will not change their diet, it is a perfectly reasonable choice. I am not asking you to throw away a bottle that is currently working for you without speaking to your doctor first. What I am telling you is that the medical literature, going back decades, has documented that whole food sources of magnesium, and pumpkin seeds in particular, deliver the mineral your body needs in a form your body has spent its entire evolutionary history learning to absorb, accompanied by cofactors that supplements simply cannot replicate. For sleep, for blood pressure, for leg cramps, for prostate symptoms, for blood sugar, the seed delivers all 5 at once. It costs almost nothing. It tastes good. It belongs on more senior plates than it currently sits on. Anthony does not buy his supplement anymore. He has a small glass jar of pumpkin seeds on his kitchen counter next to his coffee maker. He eats his small handful every night with his dinner. His sleep is deeper. His cramps are gone. His blood pressure is in the normal range for the first time in years. His wife Beverly, who handed him the jar that afternoon 4 months ago, is the reason. If this video gave you something useful, please subscribe and share it with someone you love. Every week, I bring you science-backed, plain language health information for adults over 60, the kind of conversation most doctors don't have time for in a 15-minute appointment. And in the comments below, tell me, have you ever tried pumpkin seeds for any of the benefits I just described? Or, if you are about to try them, set yourself a reminder to come back in 4 weeks and tell me what you noticed. Your answer might be exactly what someone else needs to read before their next trip to the supplement aisle. Take good care of yourselves. I'll see you in the next one.